أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Dear fellow friends and students, we are actually trying to learn the CBC interpretation, which is the commonest, investigation we are doing. But while interpreting, there are difficulties because of the back knowledge, because of the previous knowledge, because of the basic knowledge, and that is why it is difficult to interpret it in certain circumstances. We have reached up to session 4, in which I want to do the CBC interpretation, which I have done previously, the total leukocyte count. We are doing the WBC series, or we can say a leukocyte index. Now, second part of this WBC is after seeing the total leukocyte count, the normal one, it is called the normocytosis, or we call it the leukocytosis. If it is higher, if it is lesser, it is called the lymphopenia. After watching and seeing the count, do differential leukocyte count. It is very important to see whether the WBC count is normal, or it is raised, or it is reduced. Now, all of these circumstances, you have to check it, because this is important. The neutrophils, which are the main invaders in acute inflammation and other traumatic conditions, neutrophils normally in our setting it is 50 to 70%. Significant reduction will be less than 40%, and a higher level will be achieved after 75 to 80%. Lymphocytes normally it is 20 to 40%, less than 15% significant reduction. 45% more than that is the definitely significant increment. The monocytes are concerned, less monocytes are not, actually they are very less in number already, 0 to 4 or 5 rather, hardly. So if their increment is there, if it is more than 7 to 8, then this condition is called monocytosis. The eosinophils are concerned, higher levels are famous, which is known as eosinophilia. Normally it is, in our country, it is 2 to 7%. It is more than 10%, it is eosinophilia, no doubt about it is eosinophilia. If there are clinical conditions which are relating with the eosinophils, they are more than 8% to 9%, then it is significant. Eosinophil 0 is possible. No eosinophils 0 in certain conditions. And according to certain researchers, they are diagnostic also. Their functions are different. Neutrophils have different functions. Lymphocytes have got different functions. Lymphocytes, you can say, after the progenitors is the monocytes, derivatives, monocytes, histiocytes. These are all derived from the lymphocytes. Eosinophils are a different category, which are from in the hemolytic system, and they are very important in certain type of hypersensitivity reactions and in cases of the allergic reactions. Now, see the neutrophils. Very short, the condition which is higher means the absolute count. You can calculate it by the total leukocyte count. If it is 8,000, and if it is you see 72% neutrophil count, you can easily detect how much absolute count is there. If higher count is found, then it is called neutrophilia, without involving the lymphocyte, without involving the monocyte or eosinophils. They are the primary emitters in acute inflammation. They are in traumatic condition, and they are acting as the acute phase reactant. So it is commonly increased in bacterial infections, all bacterial infections. Most common cause of the neutrophilia, seen with the staphylococcus and streptococcus, which cause the very highest count. Remember the terminologies which I am using, that is the transient bacteremia and what is called as the bacteremia, then the called septicemia, then the pyemia, and so on. And these are the what is called severity of the disease, depending upon it, how much count is there of the bacteria. It is directly proportional to the count and the activity of the bacterial infections. Now, bone marrow increases output of the storage neutrophils to the peripheral blood. It is possible that the bone marrow is active in certain situations in cases of the what is called bone marrow response, or we call as myeloproliferative type of disorders, and in these conditions, because of this, the neutrophil specifically can be increased. It depends. For example, in acute lymphatic leukemia or in chronic lymphatic leukemia, it is possibility that they may increase. And in other conditions of also other homeopathic system. The physiological leukocytosis is the leukocytosis we see in the trauma, in extreme temperatures, in childbirth, in pregnancy, and just after delivery, in the first day of the life, and you see in cases of the severe dehydration. Now, at the one time, the labs were reporting the left shift or the right shift of the leukocytes, or neutrophils in this case. Right shift means is that is acute inflammation because of some invasion of the microorganism. Left shift means that it is not invasion. It is the primary stimuli of the homeopathic system which causes the increment of the neutrophils. Nowadays, they are in some labs they are creating charts of the left shift or the right shift of the neutrophils. But it is not important to you, because as a beginners, or you can see, because I am also a beginner, but the beginners means that who want to achieve knowledge. This is my definition of the beginners. They can understand that left shift and the right shift. The left shift, the more mature neutrophils are seen. On the right shift, on the left shift, if it is left shift, it is rather predominantly immature type of the neutrophils. Their activity is not very quick. Their function is not very much higher. This is the what is concept of the left shift to the right shift, or right shift to the left shift. Now, tissue destruction and injury can cause, and metabolic disorders very large in number, they can cause the neutrophil condition because of the deposition of the substances or end products. Neutrophil input is increased from the bone marrow to the tissue. Examples including the rheumatoid arthritis or other type of the arthritis, like gout and burns and uremia and trauma, seronegative type of arthritis. Again, the neutrophils will go at the point, and it will cause the neutrophilia. Another condition which causes the decrement of the neutrophils are called neutropenia, because neutrophils got specific functions. The reduction is definitely harmful to the body. Like, for example, the leukemias and anaplastic anemias and myelofibrosis, they are replacing the neutrophils with other cells. And infections such as virus, tuberculosis, and typhoid, they are relatively there is neutropenia in comparison with the lymphocytes. So, in enteric fever, specifically speaking, the neutrophils absolute count is lower down. Even you will see with this condition as leukopenia, or it may be in the normal leukocytes. It may be normopenia, I mean to say that, and even the count is normal. The neutrophil leukocytes are decreased. This point is missed by many of the clinicians. It should be mentioned that the absolute count of the neutrophil is down. It is down. Definitely, it is seen in cases of the enteric fever, in the brucellosis. It can be seen in brucellosis, in cases of the dengue fever or dengue fever. You see, in Kranchi, it is very common problem. Abnormalities of the bone marrow and destruction or the damage of the neutrophils, which can occur by the antibodies, intrinsic antibodies, which are producing by many causes, and drug toxicities and vitamin deficiency, specifically speaking B12, which is important hemopoietic factor B1, also B2 also. Now drugs stimulating the immune system to attack cells, immunosuppressant agents which you are giving, they are suppressing the count. Autoimmune disorder themselves cause the autoantibodies like SAD, rheumatoid arthritis, Sjogren syndrome, and systemic sclerosis, etc., etc. Radiation therapy, yes, it will cause destruction of the active bone marrow. It will cause the neutropenia, even all series are affected. In very severe infections, it should be neutrophilia. In cases of the bacteremia going to the, we can say septicemia, septicemic shock, or what is called the systemic inflammatory response syndrome, or what is called the multi-organ dysfunction syndrome. In these cases, because the neutrophils, they are attacking the specific sites in the blood, that count will be lower down. This is the concept. Why neutropenia occurs? This is the concept. Because they are attacking on that places. They are aggregating on that places. Pooling of that is called pooling of the neutrophils, the one side, the same thing. Overwhelming infections occur if it is neutropenia. The problem is this, the overwhelming infection, the HIV, for example, and other opportunistic infections, and they are very large in number. I will speak only the Pseudomonas. If the count is lower down to 1,000 or 1,500, you have to give the anti-Pseudomonas therapy as a primary prevention. Heart-lung bypass and hemodialysis will cause neutropenia because, again, the same thing, the filters, filtering the blood by a machine can cause sticking of the neutrophils or old neutrophils to the chamber, and in this way the neutropenia occurs. Hyperesperism, because the apoptosis occurs at one time with the neutrophils, and they will die, and it should be removed by the reticuloendothelial system. The most powerful reticuloendothelial system exists in the spleen. In case of hyperesperism, for example, rather secondary to the, for example, to the portal hypertension, the neutrophil count can be reduced. Lymphocytosis, yes, 20 to 40% is a normal one. It is called relative lymphocytosis because the count may be normal, it may be raised, it may be reduced even, total count. In spite of it, there is the absolute count of the lymphocyte is increased. Nowadays, some laboratories is also given the absolute count parallelly, because time there is no time for the person to calculate it. Lymphocytosis occurs in a chronic response. ये जो है ना सेकेंड इन्वेजन से न्यूट्रोफिल्स के बाद शुरू होता है. एक्यूट इन्फ्लेमेशन जब हो रहा होता है, तबाहियाँ मचा देता है, तो अब इसको आगे जाने के लिए, लड़ने के लिए दूसरी सहारे की ज़रूरत होती है. और लिम्फोसाइटोसिस जो होते हैं, lymphocytes attack on the site. The causes, specifically speaking, in which you found in the blood, the lymphocytosis, are the viral infections. Typical केस होता है, आपके यहाँ होता रहता है, लोगों को जो है वो वायरल इन्फेक्शन, रानो वायरस है, कोरोना वायरस है, दूसरे वायरसेस हैं, जिसको फ्लू वायरसेस कहते हैं, पैराइन्फ्लुएंजा वायरस, एक्सेट्रा, एडिनो वायरस. ये सारे वायरसेस, हेपेटाइटिस बी वायरस है, सी वायरस है, एप्शन बार में खास तौर पे साइटोमेगालो वायरस है. All viral infection can cause the relative lymphocytosis. Relative lymphocytosis. Now, tuberculosis specifically is a chronic infection, you know that, and lymphocytosis are expected in the tuberculosis conditions. Pertussis, whooping cough, in which case, again the Bordetella pertussis, colonic, this is colonic bacteria, and this cause cause the emergence of the lymphocytes at the involvement of the pertussis, and it will cause lymphocytosis. The drug reaction, different drugs are possibilities which cause the relative lymphocytosis. For example, if the person is taking a very prolonged period of time, some drug, like for example, let's say diclofenac sodium, it can cause lymphocytosis, and the other drugs, antibiotics, for example, you are taking, for example, doxycycline for a 2 month, 3 month period, it can cause lymphocytosis. Stress physiologically like traumas and cardiac arrest. Transiently there will be lymphocytosis. In malignancy, acute lymphatic leukemia, chronic lymphatic leukemias, and in cases of the lymphomas, there will be relative lymphocytosis. Reduction is seen. Lymphopenia. CD8 count is reduced mainly. We are talking CD8 count may be reduced in certain infections, which cause the because pooling of the lymphocyte at that site, it is possible. But CD4 depletion syndromes are present in HIV, AIDS, idiopathic CD4T lymphocytopenia, like arterogenic corticosteroids can cause specifically suppression of the count, and immunosuppressive agent can cause the lymphopenia. It may be a part of the what is called as the myelosuppressive syndrome, lymphopenia. Lymphocytes are very, very specific functions. Talking about only lymphocytes, we can talk 2-3 hours, because these are the very important cellular elements of the blood. Now monocytosis, because monocytes are very less in number, hardly it is 0 to 3%, but their function is very important. They are highly phagocytic type of the cell. They are large cells, highly phagocytic. Their function is to remove the debris. So monocytosis seen where the lesion occurred, in neutrophils invaded, the lymphocytes have done their work. Now the monocytes come. In cases of this bacterial endocarditis, after 3 weeks, 4 weeks, the monocytosis will be seen, syphilis, tuberculosis, protozoal infections. Mycotic and fungal infections can cause monocytosis. Malaria, systemic erythematosus, and rheumatoid arthritis, I will say, another condition, infectious mononucleosis, can cause it. Now, the lower count is हार्डली सीन, मैंने जीरो से नीचे तो कुछ भी नहीं होता ना, तो इसलिए इसको मोनोसाइटोपिनिया की टर्मिनोलॉजी इस्तेमाल नहीं करते. इजोनोफिलिया की टर्मिनोलॉजी बिल्कुल सेम है, 2 to 7%. They are reactive definitely in most of the cases because of the allergens, because of the antigen which are entering in the body, because of the hypersensitive reactions, intrinsic or extrinsic. Many types of reactions are seen as a reaction to the what is called as the antigen-antibody interactions. The common causes, therefore, are helminthic infections, asclerodermatosis, ankylosing very common infections. You see the eosinophilia. Absolute count should be calculated. Remember, before going forth with eosinophilia should be counted. How much is eosinophil in 4,000, 5,000, 7,000, or 11,000, whatever it is. It should be counted. So, if it is less than 500, it is reactive. If it is more than 500, according to the Harrison textbook of medicine, it is not reactive. It is something going all else, which is called pulmonary eosinophilia. So, helminthic infections, allergic reactions, atopic diseases, drug reactions, these are the type of the reactions which can cause the reactive in nature. If they are severe enough, persistent enough, they can cause pulmonary eosinophilia. Same. Rare causes are the chronic graft versus host disease, Hodgkin disease, B or T cell lymphoma, leukemias, eosinophil counts are there, Langerhans cell histiocytosis, it is interstitial lung disease, where the eosinophils are invaded. Indolent systemic mastocytosis again is another condition which is called mastocytosis. Specifically, eosinophil counts are increased in the subtype of the mastocytosis. And solid tumors and malignancy can cause eosinophilia, remember, and scabies and other infestations on the skin. There are fleas and ticks persistently invading the tissues of the skin. They can cause eosinophilia. Allergic bronchopulmonary aspergillosis is called ABBA can cause it, aspergillosis. And chronic inflammatory disorders like inflammatory bowel disease and autoimmune diseases can cause the eosinophilia. It may be mild type, but very severe eosinophilia can be seen in polyarteritis nodosa, a very important disease in which the eosinophil count are increased. अगर इनमें से एक चॉइस किया जाए, SLE RA लिखा जाए, इसमें शॉगरेन सिंड्रोम लिखा जाए, सिस्टेमिक स्क्लेरोसिस लिखा जाए, पॉलीआर्टेरियल नोडोसा लिखा जाए, तो काउंट जो सब में सबसे इम्पोर्टेंट है eosinophil का बढ़ जाता है, वो पॉलीआर्टेरिटिस नोडोसा में बढ़ता है और उसकी अपनी एक वजह है, वो इस पर डिस्कस नहीं कर रहे। eosinophil काउंट अगर रिड्यूस हो जाए, आप बोलेंगे भाई रिड्यूस का क्या मतलब है, वैसे ही 1 to 5% है, ना होने के बराबर है। हाँ, अगर ये जीरो हो जाते हैं, वो एब्सोल्युटली है ही नहीं, मिलते ही नहीं है, तो वो जो है जो रिसर्चर्स कहते हैं कि इन केसेस ऑफ दी what is called as the enteric group of fevers, बैक्टीरियमिक फेज जब होता है, एक्चुअली ट्रांजिएंट बैक्टीरियम के बाद बैक्टीरियमिया और सेप्टिसीमिया होता है, उस फेज में eosinophil काउंट जीरो हो जाता है, तो वो एक डिटेक्टर हो जाता है हमारे लिए। देखिए ना, यही डिजीज़ जो है ना, ल्यूकोपेनिया कॉज करने वाली बहुत सारी डिजीज़ हैं, प्लेटलेट काउंट कम करने वाली बहुत सारी डिजीज़ हैं। अब हम उनसे रिलेट करें और अगर उनमें से आपको मिल जाता है कि eosinophil काउंट जीरो है बिल्कुल, तो आपके बारे में आपको ध्यान में आना चाहिए कि इंटेरिक फीवर ये हो सकता है, इट इज़ पॉसिबल। एब्सोल्यूट eosinopenia, zero eosinophils. I hope this very small discussion can help in the interpretation of the differential leukocyte count. Inshallah, we will meet again with another session very soon. Wama alayna illa al-balagh.